Welcome to Healthcare Authority's Apple Health Quarterly Webinar. Today's webinar is focused on the Reentry Initiative, brought to you by the Eligibility, Policy, Innovation, and Community Support Team within the Apple Health Services and Operations Division. Consolidated Appropriations Act 2023 and Reentry Initiative. Consolidated Appropriations Act of 2023 introduced new Medicaid and Children's Health Insurance Program requirements intended to improve healthcare transitions and access to services for eligible juveniles. There are two sections of CAA 2023. Under Section 5122, states have the option to provide Medicaid benefits of all eligible services for eligible juvenile clients who are pending disposition of charges, otherwise known as pre-adjudication. Under Section 5121, states are required to provide a limited set of mandatory services for eligible juveniles who are within 30 days of their scheduled date of release from a public institution following adjudication. Washington State implemented both sections of the CAA 2023. Due to the inmate exclusion rule, Medicaid payments are prohibited for care or services for any individual who is an inmate of a public institution as defined in the Washington Administrative Code 182-500-0050. Currently, Washington State suspends Apple Health benefits for individuals upon incarceration, allowing only to cover inpatient hospital stays of 24 hours or more. However, the CAA 2023 provisions allow Medicaid and CHIP services for eligible juveniles in pre- and post-adjudication. When discussing juveniles, eligible juveniles are individuals who qualify for Apple Health and are either age 20 and under or aged 18 or older but under age 26 who aged out of foster care on or after their 18th birthday. The Reentry Demonstration Initiative is a new Apple Health initiative under the Medicaid Transformation Project approved by the Centers for Medicare and Medicaid Services on June 30, 2023. Under this initiative, individuals incarcerated in a participating facility and are Apple Health eligible will receive a set of pre-release services up to 90 days before their release. All carceral facilities across the state are impacted by the CAA 2023, and if they are participating in the Reentry Initiative, these impacted carceral facilities are juvenile detention facilities, juvenile rehabilitation facilities, county, city, and tribal jails and prisons. Reentry Initiative timeline. Facilities not participating in the Reentry Initiative pre-adjudication are required to implement Section 5122 by July 1, 2025. For post-adjudication, they are required to implement Section 5121 services by July 1 of 2025. Healthcare Authority collaborates with facilities to support Medicaid activities, including verifying Apple Health eligibility and enrollment, Apple Health applications, and Medicaid suspension. Facilities meet the requirements of CAA 2023 by participating in the Reentry Initiative. At post-adjudication, states are required to implement Section 5121 services along with Reentry Initiative benefits as they go live in a cohort. A facility may join a cohort with other facilities in the Reentry Initiative project. To learn more about participating, visit the Reentry from a Carceral setting. A facility not participating in the Reentry Initiative must meet both CAA requirements, pre-adjudication and post-adjudication. This chart outlines the Reentry Initiative cohort timelines and key milestones, including go-live dates. For more information on facilities and their participating cohort, you can visit Healthcare Authority's Reentry from a Carceral setting that is linked on this slide. This information is also listed on our resources page. CAA and Reentry Initiative benefits. This chart describes CAA required benefits in more detail for each section. Section 5122 provides full Medicaid benefits consistent with the individual's eligible program, and Section 5121 requires a set of services 30 days prior to release and post-release requirements. This chart describes the required benefits under the Reentry Initiative and highlights the CAA 2023 required benefits under Section 5121. This chart provides comparison of benefits for eligible juveniles in a facility that participates in the Reentry Initiative versus a CAA-only facility. Eligible juveniles in pre-adjudication status under Section 5122 of the CAA have access to full Apple Health Medicaid benefits whether a facility participates in the Reentry Initiative. Eligible juveniles in post-adjudication will have up to 90 days of reentry services in a participating facility versus up to 30 days of pre-release services in a CAA-only facility. Reentry Initiative 90-day rule. The Reentry Initiative requires participating facilities to provide a limited set of pre-release services 90 days before an individual's estimated release date or ERD. The 90-day rule is defined by, for long-term stay, if an individual has an ERD at intake, the 90-day reentry services period begins 90 days before the ERD. For short-term stays, if an individual does not have an ERD at intake, the 90-day reentry services period will begin at the booking date. One thing to note, a 90-day reentry period may restart when an individual's ERD or carceral setting changes, regardless of the days of services from a previous 90-day period. When an individual is released from incarceration, their Apple Health is unsuspended and continues with the same managed care plan they had before being incarcerated. Eligibility and application support. Facilities participating in the Reentry Initiative are required to support and assist individuals apply for Apple Health. Facilities can train staff to become a volunteer assister, work with community assisters, or work with navigators located throughout Washington State to support application process for the incarcerated individuals. Facility staff can complete eligibility training for Apple Health coverage to assist individuals when applying or renewing Apple Health coverage for Magi-based medical programs through the Washington Health Plan Finder. This training includes instruction on how to navigate the Washington Health Plan Finder application web portal, security training, and eligibility factors. You must complete 7 modules and pass the assessment test to become an HCA volunteer assister. If your facility is interested in offering certified assister, please contact the email box HCA volunteer assister at hca.wa.gov. Navigators are located across Washington State and can help individuals through the application and enrollment process. Washington Health Plan Finder navigators are trained and certified by the Washington Health Benefit Exchange. To search for a navigator, a link has been added to this slide to help you locate one near you. Resources. For more information on the CAA of 2023, a link to the handout is provided as well as the Reentry Initiative webpage. For specific questions on the Reentry Initiative, please click on the link provided. If you have a specific Apple Health program topic you would like for us to do a webinar on, please email us at hca.eligibilitypolicy@hca.wa.gov. Thank you for attending today's webinar on reentry.